Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. Hello everyone, my name is Professor Matthew Rimmer. I work at QUT in Brisbane, Australia. I'm very pleased to be here for my third presentation for the Creative Commons Summit in 2020. My first presentation looked at the Internet Archive and the National Emergency Library and considered some of the issues around copyright law and the coronavirus. My second talk last night was looking at the people's vaccine, and it kind of considered patent law and access to essential medicines and some of the debates around the intellectual property responses to the coronavirus. My presentation tonight is going to look at the response of the maker movement and the 3D printing community to the coronavirus. As is always the case at QT, I'd first like to acknowledge the traditional owners of the land and pay my respects to Indigenous elders past, present and future. I would also like to recognise that QT has long been a place of Indigenous research and learning. And I should also kind of add that as part of my particular project looking at intellectual property and 3D printing, I've been very interested in Indigenous makers and some of their approaches to making culture. So the talk tonight is part of a kind of a project that I've been doing for the Australian Research Council on intellectual property and 3D printing. This is a discovery project. We're 3.5 years into the project at the moment. The project has kind of ranged across a whole different set of fields of intellectual property. So I've looked at copyright law, designs law, patent law, trademark law, and trade secrets law, as well as some kind of adjoining fields of regulation of 3D printing. The major output of the project thus far is this kind of edited collection that I did with Janusha Mendez and Mark Lemley called 3D Printing and Beyond, Intellectual Property and Regulation. But there's also a range of other book chapters and articles that I've been publishing in the area. I have provided a few of those documents in the program if you're kind of interested in the topic more broadly. I've been very lucky to be able to visit the last couple of Creative Commons summits, one in Canada and one in Portugal. And during my visits to those summits, I've been doing some of my field work in relation to the project. So as part of the fieldwork, I've been making visits to makerspaces, fab labs, tech shops, and other innovation hubs in a range of different jurisdictions, including Australia, Canada, the United States, the European Union. In addition to that kind of empirical research, I've also been doing some data analysis in relation to intellectual property and 3D printing. And I've also been kind of looking at litigation and policy responses in the area. It was striking last year as I wandered around the European Union that there are a number of projects focusing upon healthcare and 3D printing. So as I was visiting a range of different countries, including Austria and Portugal and the Netherlands and Germany and Switzerland, I kind of came across a number of 3D printing projects designed to promote healthcare, medicine, and even disability rights. So I visited some doctors in the Netherlands who were using 3D printing to make prosthetics, both in the Netherlands but also in Sierra Leone. After a kind of an encounter at the Craft Commons Summit in Portugal, I had a good chat to a Belgian group who were using 3D printing to make assistive technologies for those with disabilities. And I also had a chat with MSF, who had set up a makerspace in a refugee camp in Jordan and were using the makerspace to particularly develop prosthetics to help refugees and people from the surrounding regions who had been particularly affected by landmines and some of the conflicts that had been happening in the surrounding countries, to kind of make prosthetic arms and prosthetic legs. So last year I was kind of really excited about doing that fieldwork, and I was thinking about some of the healthcare connections in the sense of intellectual property and 3D printing. Some of these organisations relied upon open licensing to make their technologies available and accessible. Others tried to dedicate them to the public domain. But those civil society efforts did try to grapple with some of the larger questions about intellectual property and 3D printing. So it was kind of very striking to me as the coronavirus broke out that a number of 3D printing networks and communities were trying to respond to that crisis through the development of networked local manufacturing of technologies that were in short supply. So my presentation tonight is really a kind of an effort to consider that very dramatic effort by the maker movement to respond to the public health crisis and assist in the public health response as well as the economic response to that great emergency. And I guess this presentation in many ways kind of builds upon some of my other work in the area. I should also kind of mention that there have been a number of postdoctoral researchers working with me on this project. And I've also had a master's student, Samuel Lebau, who was presenting earlier in the Creative Commons Summit, having a look at 3D printing and intellectual property in the context of South America and the response there to the coronavirus. So to begin with, I found the coronavirus pandemic quite confounding for my research on IP and 3D printing. As a kind of a field worker, I was no longer able to do field work and be able to kind of visit Fab Labs and makerspaces and talk to 3D printing makers in person. But nonetheless, I have been trying to kind of track the various different efforts in jurisdictions to gather together a whole wide range of efforts to provide much needed supplies in the emergency response. It's been a little bit difficult to kind of get an overview of all that activity. There's been so much going on all around the world that has been a little bit difficult to track. I found a piece in Nature Materials very useful in kind of providing some sort of bird's eye view of this activity. This is a piece by Yu Ying Clarissa Chong and her collaborators in Nature Reviews Materials. And the piece is called The Global Rise of 3D Printing During the COVID-19 Pandemic. This excellent piece has observed that in the heat of the COVID-19 pandemic, 3D printing has stepped up to become a vital technology to support improved healthcare and our general response to the emergency. The crisis has highlighted how 3D printing can be at the base of a greener and more environmentally friendly future. 3D printing, thanks to the possibility to produce parts on demand, can reduce waste and inventory. Its inherent flexibility and the possibility to modify designs available online are unleashing creative and sustainable solutions that can carry the technology forward in the new normal. Supply chains are expected to be shorter and more fragmented as the global economy reopens. These changes will result in different manufacturing procedures with more partnerships in an open, additive manufacturing ecosystem. The main attributes of 3D printing, a high level of customization for specific needs, and decentralized manufacturing are likely to bring about local microgrids of 3D printing factories. Their piece is also very kind of helpful in its efforts to kind of chart the sorts of 3D printing activities that have been taking place during the COVID crisis. So this useful kind of overview kind of highlights that there's been 3D printing of medical devices, such as ventilator valves, mask connectors, emergency respiration devices, non-invasive PEEP masks. There's been 3D printed swabs. There has been 3D printing training and visualization aids like medical mannequins and biomodels. There has been 3D printing of personal protective equipment, so face shields, respirators, metal respirator filters. There has been 3D printing of personal accessories, face masks, mask fitters, mask adjusters, and door openers. There's also even been a bit of 3D printing of emergency dwellings like isolation wards. When I was doing my fieldwork last year, I was visiting the Netherlands, and there was lots of activity in relation to 3D printing of houses and bridges and architecture. So it's interesting to see that 3D printing has even been used in the kind of creation of disaster relief mobile buildings. So that kind of provides a really helpful overview, I think, of some of the applications of 3D printing. In my presentation, I'm going to kind of focus upon a number of jurisdictions. So mainly some of the jurisdictions that I've been visiting during my fieldwork. I'm going to be kind of having a look at the United States, where Dougherty of Make and Make magazine has promoted Plan C, in which volunteers have worked together to produce personal protective equipment. In Canada, an educational 3D printing company pivoted and made the Canadian Shield. In the European Union, there's been some controversies over the 3D printing of ventilator valves. The Fab Lab Network has sought to overcome a breakdown in supply chains. And Australia and New Zealand 3D printing has also been used to augment supplies of personal protective equipment. In terms of some of the legal issues emerging in relation to 3D printing and intellectual property and medical regulation and product liability, there's been a range of different issues that have emerged. So particularly in relation to intellectual property, I think there's been really significant issues about the right to repair and whether or not there is a right to repair, particularly medical equipment. But there's also been a large conversation about whether medical devices and things like manuals should be subject to intellectual property protection in the first place? Should they be subject to open licensing, whether under the Creative Commons licenses or under some other form of open software or open hardware license? There's also been a lot of discussion about whether such COVID technologies should be dedicated to the public domain. So last evening in my presentation, I talked about the large debate about intellectual property and access to medicines. One of the proposals at the moment is that there should be a waiver in relation to the TRIPS agreement, covering a whole range of different forms of intellectual property. There's also been some issues about medical regulation. So normally medical regulators have been kind of grappling with setting in place some new models for personalised, customised medical devices and equipment that have been 3D printed. Lots of volunteers and amateurs getting involved in the 3D printing of personal protective equipment and other medical items have kind of raised kind of questions about medical regulation. And a lot of the medical regulators have sought to respond quickly to have some provisional rules in place. There's also, I guess, larger questions about product liability. So my colleague Angela Daly, who has now moved back to Scotland, wrote a very pioneering piece of work on regulation of 3D printing, and she flagged at a very early stage kind of the importance of the issue of product liability around 3D printing. And in the context of healthcare and medical care, I guess that's becomes quite an important issue. You know, what happens if you have a 3D printed piece of protective equipment that is defective or not up to standard? How do you deal with those issues? As I was kind of preparing this presentation, I kind of realized that I really needed to focus a little bit more in terms of a larger overarching argument. And I actually found the work of Cory Doctorow very helpful in kind of trying to centre the paper that I'm giving. Cory Doctorow has contemplated the right to repair in the times of the COVID pandemic. He considered the local 3D printing of replacement parts for ventilators in a hospital in Brescia, Italy, and the ensuing controversy over intellectual property and the right to repair. Doctorow noted that the global supply chain shutdown has revealed the fragility of long-distance, complex manufacturing systems that are organised around central hubs that represent points of critical failure. The surge in open source hardware designs and parts for medical equipment during the emergency represents a distributed, urgently needed decentralisation of our world's critical manufacturing capacity. Even as these distributed efforts reduce the hazards of failing health systems, they have the potential to create their own hazards. The best way to ensure that emergency repairs and modifications are safe is for original manufacturers to cooperate with community technicians. We can't simply leave our hospitals undersupplied or sitting on broken hardware until the emergency has passed. Doctorow has kind of emphasised that the right person to decide whether a field repair should be attempted and whether the repair is solid enough to rely upon are medical professionals, not the shareholders of medtech companies or the lawyers who wrote their terms of service and patent applications. He contended, we're all like farmers now, isolated with machinery that we can't afford to sit idle until a distant company can help us repair it. Doctorow maintained, today we need those companies to step up by providing repair instructions, specifications and technical aid to the global volunteer core of makers and fixers who have given themselves over to helping us all weather this calamity. There's been a very long-standing debate about intellectual property and the right to repair, and confusingly, different regimes of intellectual property have dealt with the right to repair in somewhat different ways. So, for instance, the designs regime has sometimes recognised an explicit express spare parts defence that enables repairs. So Australia, for instance, has a right to repair recognised, under our Designs Act. However, under copyright law, there has not necessarily been the same level of explicit recognition. There has been some debate about whether more general copyright exceptions, like, say, the defence of fair use, could apply in relation to repairs. There has been a very heated debate about the impact of technological protection measures on the right to repair. There was an excellent paper by Lee, Chan and Grindvord and Ofer Sinai called Intellectual Property and the Right to Repair in the Fordham Law Review. And they have been kind of grappling with some of those questions around copyright law and the right to repair. In respect of patent law, there's been a very murky debate over the right to repair. There has been some very fine distinctions drawn between what is a patent infringement and what is an acceptable use of an invention. So sometimes the courts have drawn some very fine lines in respect of what is permissible in terms of a repair. And even in trademark law, there has been a lot of concerns about the right to repair. Apple has brought an action against a Norwegian repairer of late. So my argument in my presentation is we need a holistic right to repair in intellectual property that cuts across all those different domains. We can't have such disparate rules according to the discipline of intellectual property. Moreover, I think it needs to be a general right to repair. Thus far in the debates in Australia and the United States and elsewhere, there have been some very technology-specific proposals in respect of the right to repair for automobiles and tractors. And I guess my position is that there needs to be a general right to repair that cuts across all the various technology domains. As the COVID crisis has shown, we do need to recognise a right to repair in respect of medical equipment, amongst other things. But moreover, we need to kind of think about the relationship between intellectual property and other forms of regulation. You know, consumer law and competition policy have an important bearing on the right to repair. Their sustainable development goals are designed to boost responsible consumption and production and promote a circular economy. But I think in the context of the COVID crisis, it's become very clear that the right to repair is, amongst other things, a kind of a question about health law and a larger question about medical regulation as well. So I think we need a stronger recognition of the right to repair. And I guess that's my kind of key central message that I would like to kind of provide in my talk today. So I'd now like to kind of do a quick survey of some of the ways in which the maker movement and the 3D printing industry have responded to the COVID crisis. And I guess the responses differ jurisdiction by jurisdiction. In the United States, it's been very notable that the maker movement has sought to organise itself to respond to the COVID crisis. So there was a bit of a crisis with the maker movement. Essentially, the Make media became an entity that went into dissolution, and they've kind of reconstituted themselves as a maker community. And kind of running the Make magazine on a more amateur basis or community basis. Dale Dougherty is still leading Make and Make magazine, and he wrote a very kind of powerful piece in this edition of Make. He said that self-organising efforts and a widely distributed infrastructure provided for a unique civic response of makers to COVID-19, not just in the United States, but around the world. As COVID-19 began to spread, makers launched a series of countermeasures to address shortages of medical supplies and equipment in communities and protect frontline workers and the public from greater harm. Working alone at home but together on the internet, makers collaborated to design new medical gear that could be 3D printed or laser cut anyway. They organised expert networks to evaluate those designs medically and mechanically to be sure that they'd got the job done. They fired up their own machines, and those borrowed from universities and makerspaces produced millions of pieces of personal protective equipment and other gear, and they formed delivery networks to connect with frontline health workers and hand over the goods. Dougherty called this maker response Plan C. He said, if the government's response to the crisis is Plan A and the industry's response is Plan B, then Plan C is the backup plan for the backup plan. The Plan C countermeasures of makers might not be the best option if Plan A and Plan B afford better ones. Countermeasures are an appropriate response, preventing a bad problem from becoming worse. Countermeasures can show the way to systematic changes as well. So in his vision, really, makers provided an important kind of community response. And he said the maker response to the pandemic has been fast, flexible, and just flat out incredible. I'm beyond proud to see the maker movement rise up for this moment. Makers have done what is needed to be done in a way that hasn't been done before. Think of it as open and public research and development outside institutional boundaries, and good for all those things that don't have a business model and wouldn't be done by industry, but perhaps should be done by government someday. And he said that, perhaps there's a need to kind of think about the maker movement in the future, playing this kind of community role. He kind of says our society must increase our capacity for local production and create a sustainable economy. We must improve the resiliency and response of our institutions through new leadership. More than ever, the future needs more makers. And I've certainly kind of heard in the past of 3D printing being kind of contemplated as part of disaster response mechanisms, but it's been kind of very striking how there have been a whole wide range of projects that have been set up to respond to the coronavirus crisis. And it's been fascinating seeing the virtual Maker Fair this year and hearing about the many innovative and creative responses that have taken place. So Dale Dougherty has been in conversation with the Maker Caucus in the United States Congress and has kind of promoted this option as a way forward to augment government and industry responses. And I think that's kind of been particularly important in the United States, given that the federal government has not necessarily provided much leadership in the response to the coronavirus. It's often been left to the states and cities to sort out some of these issues themselves. And I think that the Maker movement has kind of provided a helpful response. Dr. Sally Aplin, who is an anthropologist who does work in Silicon Valley, has kind of provided a really useful set of insights into the Maker movement and its response to the COVID pandemic. She kind of noted that right now, all over the world, people are engaging in the construction of critical supplies and personal protective equipment, respirators and other clinical items using tools and techniques such as 3D printing, sewing, repurposing factory equipment and other skills and ways of thinking. These innovations in part seem to have risen up from an early foundation of Maker Faire education. This education and the communications describing it have created a pipeline for information of how to innovate personal protective equipment rapidly across the globe. And she observes there's this history that now critically comes into play with the coronavirus for the spirit of hacking, making and cooperative learning that is going around the world is based on a straight out of Maker Faire ethos. So I think her kind of important point is that the Maker movement has provided a set of educational tools and skills and learnings that have been very helpful in terms of responding to the public health crisis. It's also been notable that a number of open source companies have pivoted during the crisis. Lima Freed and Adafruit Industries are based in New York, and they have traditionally provided a wide range of educational equipment and kind of designs and all sorts of sets that people can buy and make up. During the crisis, they have pivoted and have become part of the essential industry in New York in terms of making personal protective equipment. Lima Freed and Adafruit Industries also have a role in the COVID recovery response in New York City. So I know that there's a lot of interest in the open hardware community, and Adafruit Industries have been great champions of using open hardware licenses. So I think their approach has been very notable. Avi Rakenthal has provided some useful stock taking of some of the 3D printing responses to COVID-19. And he has kind of looked at the way in which some of the commercial 3D printing companies have responded to the coronavirus crisis. I think he is very kind of conscious about the need to improve standards and quality in terms of what has been 3D printed. So in terms of his reflections upon the response of the 3D printing community, he has kind of emphasised not only the need for collaboration, but also the need for coordination and a need to ensure that a high quality of product is developed. During the debate over intellectual property and 3D printing and the coronavirus, there's been a push by a number of repair organisations to try to overcome some of the difficulties, particularly in terms of repairing broken medical devices. And a number of these organisations, PIRG, Repair.org, iFixit and Public Knowledge, have been champions of the right to repair in various different public policy debates at a federal level and in various states. But it's been noticeable that they have been petitioning for a right to repair in the context of medicine and medical equipment. Their joint petition read, US hospitals do not have enough ventilators to meet the spike in cases of respiratory failure that the novel coronavirus is projected to create. The petition emphasised that it will become critical to remove barriers to repairing ventilators, and we may need to repair older reserve ventilators so they can be put into service. The petition demanded, I urge you to immediately release service information, manuals, access to error logs and diagnostic information or other repair resources for hospital ventilators to help our hospitals combat the coronavirus. Nathan Proctor, the very eloquent Right to Repair campaign director with USPIRG, said that ventilator repair and maintenance issues are life and death issues. He said, manufacturers of ventilators should release service manuals, service keys, schematics, and service keys. Lives are at stake. There is no time to be proprietary. From removing barriers to repair to ramping up production, there are steps that we must take now to maximise ventilator supply and save lives. Likewise, Gay Gordon Byrne from the repair.org has observed that the coronavirus pandemic has proven that manufacturer restrictions on access to repair information and technicians is a recipe for disaster. iFixit says that it's been a headache to find the right information to fix ventilators. Carl Waynes has said, we want to make sure that a technician doesn't have to hunt for these manuals. Every second counts right now. iFixit in particular has kind of run into copyright conflict in terms of publishing manuals on the web before. Public knowledge has kind of highlighted that during the peak of the COVID crisis in Italy, hospitals struggled to find official replacement valves and eventually partnered with a 3D printing company to make unofficial replacement valves. California needed to refurbish out-of-service ventilators after failing to get quick results from official repair providers. California ultimately turned towards the tech entrepreneurs in its own backyard to find a solution. Even though the state of emergency has made such measures necessary, has not stopped IP protectionists from clamouring that such measures are wrong and illegal. Notably, a number of congressional leaders have responded to these concerns that intellectual property owners have been hampering repairs in respect of critical medical infrastructure and equipment during the COVID-19 pandemic. So in the documents with the program, I've shared this bill, the Critical Medical Infrastructure Right to Repair Act of 2020. It's still currently a bill that is under debate in the United States. Senator Ron Wyden is the co-sponsor of this bill. Senator Ron Wyden won a Pioneer Award with the Electronic Frontier Foundation for his work on intellectual property innovation issues. He was something of a turncoat in the debate over the Trans-Pacific Partnership, going from being a critic of the Trans-Pacific Partnership to a supporter of the Trans-Pacific Partnership. But nonetheless, he's had a strong interest in intellectual property issues and open access issues. He was a defender of Aaron Swartz, amongst other things. So all things considered, Senator Ron Wyden has been quite a good soul in terms of some of the intellectual property debates. So he has urgently introduced this right to repair legislation with his colleague, Representative Yvette Clarke, who is a New York Democrat. So they've introduced versions of this bill both in the House of Representatives, which the Democrats control, and in the Senate, which the Democrats do not control. Oregon Senator Ron Wyden, who initially, interesting enough, did a lot of work as an advocate for seniors and elders in the United States, has maintained that there is no excuse for leaving hospitals and patients stranded without necessary equipment during the most widespread pandemic to hit the United States in 100 years. He commented, it's just common sense to say that qualified technicians should be allowed to make emergency repairs or do preventative maintenance and not have their hands tied by overly restrictive contracts and copyright laws until this crisis is over. Yvette D. Clarke has observed, as America grapples with this lethal pandemic, we are also experiencing unprecedented shortages of medical equipment. She contended this narrowly tailored, common sense and time-limited bill will ensure critical medical items like ventilators do not go to waste due to maintenance restrictions that have no nexus to safety. Clarke contended during this health crisis, we must do everything in our power to provide and expand access to life-saving services. I just want to kind of take you through the bill itself quite quickly. Section 1 of the bill provides its short title. Section 2 provides definitions. Section 3 provides for a new clause in the Copyright Act, which would provide for a limitation on exclusive rights, particularly dealing with the incidental copies of service materials made during the maintenance or repair of critical medical infrastructure. Section 3 also provides for an amendment to Section 1201 of the Copyright Law to provide for the permissible circumvention of a technological protection measure to repair or maintain critical medical infrastructure with respect to that covered healthcare provider. So there's provisions there dealing with copyright law. Section 4 of the legislation amends Section 271 of the design patents regime, In the new legislative provision, it shall not be an act of infringement with respect to a patent for a design obtained under Section 171 for a covered healthcare provider to fabricate a part on a non-commercial basis and as needed for the repair or maintenance of critical medical infrastructure. Section 5 deals with contracts, and that new provision seeks to prevent the contracting out of the right to repair. Section 6 focuses on manufacturer requirements. Section 7 calls upon the Federal Trade Commission, the Register of Copyrights, the Under-Secretary of Commerce for Intellectual Property, and the Director of the United States Patent and Trademark Office to conduct a study regarding the impact and effectiveness of the Act and the amendments made by this Act with respect to innovation and anti-competitive practices in the market for critical medical infrastructure, including enforcement with respect to those practices. So it's quite a targeted piece of legislation in some ways. It's not a general right to repair defence cutting across all the different forms of intellectual property and all the different forms of technology. It seems very much focused upon repair in the context of medical infrastructure. Oregon Senator Ron Wyden recently wrote an op-ed in Future Tense in Slate on the 12th of October 2020 with the President of the American College of Clinical Engineering on the need for the United States Congress to support the bill. They have despaired. Too many hospitals face long waits for authorised technicians to repair life-saving machines. Wyden has noted this common sense legislation would allow trained repair technicians to more easily access the information and tools they need to fix and maintain critical medical infrastructure during the COVID crisis. This legislation has been supported by rural doctors and healthcare providers. Wyden and Coley also supported a more general right to repair in the future. You know, Americans should always have the right to repair the vehicles, tools, and devices they own. There's also been support for the legislation from Colour of Change, who have noted that Black people in the United States have been particularly adversely affected. There has also been support from R Street. Mike Goodwin has noted that this bill is very carefully crafted. There's also been support by the repair organisations that I mentioned earlier and the Niskin Centre. So we'll see what happens with the progress of that bill. But I think perhaps it's a good starting point to try to provide greater recognition of the right to repair in the United States. And I think other jurisdictions need to kind of consider this issue as well. There's also been various efforts by universities and research institutions to 3D print medical equipment and personal protective equipment during the pandemic. In my presentation last night, I talked a little bit about public licensing, and I think there's lots of scope for public licensing. Creative Commons have championed the Open COVID pledge, along with scholars like George Contreras. It's been very notable that some of the 3D printed technologies have been subject to the Open COVID pledge, such as 3D printed swabs and 3D printed respirators. So those are some very kind of useful applications of the Open COVID pledge in the context of 3D printing. Professor Joshua Pierce from Michigan has been a great champion of open models of licensing in relation to software and hardware, but particularly in relation to medical equipment. So he has been writing some eloquent papers about the need for distributed manufacturing of open source medical hardware for pandemics. Okay, just looking at the time, in the next 10 minutes, I'll just kind of give you a quick sense of what's happening in some other jurisdictions. And then I'll save 10 minutes at the end to kind of consider some questions and some thoughts that you might have. In Canada, it's been very noticeable to see some of the 3D printing companies pivot and shift to the manufacture of personal protective equipment. So Canada, for instance, has companies like Inksmith that have been focused upon educational applications for 3D printing. During the pandemic, they reinvented themselves and started creating plastic face shields for use during the COVID pandemic. In terms of their mission and vision, the Canadian Shield is a simple yet innovative, made in Canada solution to the global personal protective equipment shortage. Its guiding mission is keeping Canada's workers safe by ensuring that they have access to proper personal protective equipment while bringing personal protective equipment manufacturing back to Canada. The Canadian Shield is working to support our country in its time of need, so we don't have to rely on global supply chains to keep our workers safe. We want to help build a Canadian health sector that's prepared for the next global health crisis. So that has been very kind of notable, the way in which this Ontario company has kind of worked with Health Canada to get regulatory approval and has worked with local doctors and nurses to create a user-friendly design. They've also made the shield of material that can be properly disinfected and sanitized and is cost-effective, is compatible with other forms of personal protective equipment. It's received a number of testimonials in terms of the operation of the system. So Michael Garron Hospital said that when we are fighting a battle on so many fronts, any and all reinforcements are greatly appreciated. Emily from the Grand River Hospital was very happy about the shields. Canada had a terrible problem in terms of aged care homes being affected by COVID, much like Australia. Christy Calhoun said, I work with elderly people that struggle to read my lips when I am performing hearing tests, and she found that the clear personal protective equipment was very helpful in terms of the use of that equipment. Justin Trudeau has been delighted by the way in which the company has responded to the crisis, and he has kind of noted in terms of his work that really the Canadian Shield has provided a very useful role in supporting the government of Canada in terms of its response. The Innovation Minister as well in Canada has kind of talked about the importance of Canada's innovation superclusters, and the innovation superclusters have been able to draw upon their various forms of expertise in different regions of Canada in across topics like advanced manufacturing and healthcare, and they have been able to kind of respond to the crisis as well in terms of a coordinated approach. It's been very noticeable that Canada's response to the crisis has been much better in many ways than its neighbour, the United States. As I was mentioning last night, a number of Canadian scholars, such as Professor Richard Gold from McGill University and Professor Jeremy De Beer, have advocated the need for open innovation in the development of COVID technologies. And I think in the sphere of 3D printing, we have certainly seen some very innovative responses from the Canadian government in terms of their response to COVID. There's also been an effort by the Canadian government to work through some of the regulatory issues that are involved in terms of getting approval for their personal protective equipment. The European Union, as I kind of mentioned at the outset, was an early epicenter for the coronavirus crisis. Even a wealthy country like Italy was very hard hit by COVID to begin with. There's been a lot of debate about a hospital in northern Italy relying upon 3D printed valves to try to fix broken technology. There's been a lot of debate about whether or not there were threats made by the intellectual property owners against the local makers who were stepping in and providing that particular equipment. The media reportage of the dispute is a little bit murky and a little bit muddy, but nonetheless, as Professor Lucas Osborne has kind of noted in our op-ed, it does raise larger questions about possible clashes between intellectual property and 3D printing, particularly in the context of the right to repair. I guess, fortunately, in many ways, the European Union has a much more advanced discourse about the right to repair in terms of intellectual property and competition policy and consumer law. And it's also a very kind of strong part of the sustainable development discourse as well. The European Patent Office has done a lot of work in relation to intellectual property and 3D printing, and they have just released a big new study on intellectual property and 3D printing. At their kind of conference, they also kind of talked about some of the intellectual property issues in relation to 3D printing and also thinking about COVID responses. The European Patent Office thought there were opportunities for intellectual property owners to file patents in relation to 3D printing inventions. So perhaps there are some tensions there within the European Union between the open licensing approach of Fab Labs and the maker movement and the push at an industry level to seek intellectual property protection in relation to 3D printing. But it's certainly been very inspiring the way in which Fab Labs and maker spaces throughout the European Union have worked together to tackle the coronavirus. And the European Union has some very strong medical 3D printing companies as well. Materialise, for instance, has a very high reputation for its quality medical 3D printed products, and they have developed 3D printed oxygen personal protective equipment mask, amongst other things. The Czech company Prusa has done a wonderful job in distributing open source designs in relation to 3D printed face shields for medics and professionals. And it's been notable that Fab Labs and makerspaces around the world have relied upon their open source technologies. So Prusa have been a magnificent contributor in terms of the global response to the coronavirus crisis. But I think there are some interesting questions there about the network response of the 3D printing community in the European Union to the coronavirus crisis. I'm just running out of time a little bit, so I just briefly mentioned that in the United Kingdom, there's also been a range of these issues coming up. There's been an interesting new piece in the Journal of Intellectual Property Law and Practice looking at rethinking intellectual property rights and commons-based peer production in times of crisis, and considering the case of COVID-19 and 3D printed medical devices. Down under in Australia and New Zealand, there has been quite a bit of 3D printing of personal protective equipment, particularly by the universities, research institutions, some of the maker spaces, and some government entities as well. The Therapeutic Goods Administration have issued some guidelines over manufacturing medical devices for COVID-19, including 3D printing. But just to give you a few examples, there have been various different organisations, including the Army, who have been being put to work developing a whole wide range of personal protective equipment. So that has been very noticeable. Many of the institutions that I visited as part of my fieldwork this year have reorganised and repositioned themselves to provide 3D printed personal protective equipment. So I visited the ANU Makerspace, and they certainly have reconstituted themselves to be focused upon developing personal protective equipment. New Zealand, as I mentioned last night, has had one of the most effective responses to coronavirus. There was a temporary Shields Up New Zealand response that was focused on 3D printing standard shields and dental shields. In the end, this proved to be a very kind of temporary response, and that project is now finished. They have noted that New Zealand now has the industry capacity to kind of engage in their own 3D printing of personal protective equipment. So to wrap up, in conclusion, I think there has long been some tensions in relation to intellectual property and 3D printing. And they have certainly kind of come into focus in the context of healthcare with the coronavirus outbreak. There's certainly been tensions between the interests of intellectual property owners of medical equipment and the users of that equipment, particularly when it involves the right to repair. My argument in the paper tonight is that we need a kind of general right to repair across all the different domains of intellectual property, and it should be a broadly framed right to repair, covering all technologies and not just be technology specific. The shortage of medical devices and the amount of broken ventilators has really highlighted that this is particularly important in the context of healthcare. So my kind of key proposal from this presentation is that the open community needs to get organised in pushing for right to repair reforms at an international level, at a regional level, at a national level. But we also need to support institutions that have been engaged in repair, like iFixit. And we also need to make our voice heard in some of the litigation that has been going on in respect of the right to repair. As can be seen in some of these controversies, really the right to repair is a matter of life and death. I think the coronavirus epidemic has also kind of highlighted the role that can be played by the maker movement in working together in an organised, collaborative, collective fashion to respond to global challenges such as the coronavirus public health crisis. And in that context, open source licensing kind of plays a really important role in supporting commons-based activity in that sphere. And it's been notable that open source companies like Adafruit Industries and also the Prasa in the Czech Republic have played a really critical role. But moreover, the 3D printing industry has shown that additive manufacturing can play a really helpful role in terms of local manufacturing, developing health products, engaging in advanced manufacturing. We need to rethink our role in relation to how we use technologies. And certainly in Australia, there has been debate about how we need to become less dependent upon global supply chains for all sorts of products, and we need to reinvigorate local manufacturing. We probably have some time left for some questions and some queries in the last 10 minutes. Vladimir, who's been very active, has kind of talked about the importance of textbooks. I think that's a really important point, Vladimir. So thank you for your contribution from Finland. You've been a really helpful contributor throughout the Creative Commons Global Summit. Just to focus in on the question of manuals, I know that there's been a lot of debate about the developers of manuals claiming copyright protection in relation to manuals and then threatening litigation against repair organisations and individual bloggers who have posted PDFs of manuals up online. And I know the Electronic Frontier Foundation have been assisting iFixit in some of their disputes over manuals. iFixit, do tear downs of new technologies, but they also kind of post repair manuals of various different kinds, and they have faced various different forms of litigation. I think we need to kind of change our approach to how we deal with manuals. I think in relation to copyright law, it is problematic that we have long terms of copyright protection in relation to manuals. We need to have manuals that are openly licensed or dedicated to the public domain. I think that, Vladimir, would be a really useful approach to ensuring that material is available. But for those manuals that are still subject to copyright, we do need to kind of recognise a broad application of copyright exceptions, whether that's through the defence of fair use in the United States or through the creation of new defences for things like fair dealing in other jurisdictions that are purpose specific. But I think repair needs to be explicitly recognised as a permissible exception under copyright law. Likewise, I think it would be helpful for other regimes of intellectual property to also provide explicit recognition of the right to repair. Patent law has these very complex rules about patent infringement. I think perhaps we'd be better off with a clear defence for patent infringement in respect of the right to repair. Obviously, after the Apple litigation in Norway, I think that we do need also the recognition of the right to repair under trademark law. But perhaps also under designs law, we need a broader conception of the right to repair as well. But we need to kind of connect intellectual property to other fields of regulation as well. So I see the right to repair as also having connections to consumer law and the rights of consumers, to competition policy in terms of breaking down monopolies, to the Sustainable Development Goals. So the European Union in particular is very kind of keen on eco-design. But also I think we need to think about the right to repair as an important part of health law. Ranjit Menon says that he is currently part of an EU Maker project, and we are one of the Maker teams that are collaboratively developing, fabricating and installing and testing rapidly deployable, digitally fabricated solutions for adapting public space for safe use during COVID. So that sounds like a really fascinating project. And it's certainly been noticeable to me in the European Union that there has been a lot of thinking about maker cities and fab cities. So there's been some really interesting projects in thinking about ways and means in which 3D printing can help inform how cities go about their business, how we can have more sustainable models of production and consumption. It was very noticeable to me visiting cities such as Vienna and Lisbon and Amsterdam and Berlin, what an important role maker spaces played in local communities in all sorts of ways in terms of education and employment and in peace building in some jurisdictions like Northern Ireland, but also in terms of healthcare. So I think that's a really interesting contribution, Ranjit Menon, and that sounds like a really useful project to think about addressing COVID in terms of public infrastructure and urban structure. I'm the child of geographers, so I'm very interested in rethinking cities. And I do think that 3D printing, education and maker spaces can provide lots of innovative local solutions at a city level. So that's a really interesting operation. Oh, you're at the Alto Fab Lab, so that makes a lot of sense. So yeah, congratulations, Menon, on your work as one of the many networked activities in terms of the response to the coronavirus. So thank you very much all for your attention. I hope you have a wonderful rest of the Creative Commons Summit. I would note that the Professor Michael Weinberg, who's been a very kind of leading figure in the debate over intellectual property and 3D printing, is doing a presentation later on in the next day. And it's well worth checking out his presentation. I think he's going to be talking about 3D printing and galleries, libraries and museums. So I will be staying up late to listen to that conversation. I think there's also a really important conversation being led by Diane Peters about intellectual property and climate change and the warming world. In my presentation, I've kind of touched a little bit upon intellectual property and sustainable development. But I think there's also, the other big kind of global crisis is really climate change. And I think the open community does need to kind of grapple with some of those issues in relation to intellectual property and climate change. So all the best, commoners. I look forward to participating in some of the other sessions that come along. If you have any questions or queries or want more material, send me an email or send me a message in the chat, and I will get back to you as soon as possible. So all the best, and I look forward to meeting you in person perhaps at a future Creative Commons Summit once we have got the global crisis of the coronavirus under control. So I wish you all the very best in however you may be doing around the world in your public health efforts to respond to the coronavirus. So see you later.